Restless leg syndrome (RLS) is a neurological disorder. Look at this picture, shows that detail going on. Introduction. Restless leg syndrome (RLS), also known as Willis-Eckbone disease, is a neurological disorder that affects millions of people worldwide. It is characterized by an uncontrollable urge to move the legs, typically accompanied by uncomfortable sensations. Symptoms often worsen during periods of inactivity and are especially pronounced at night, significantly impacting sleep quality. Definition. RLS is defined as a sensory motor disorder marked by unpleasant sensations in the legs, leading to an overwhelming urge to move them. The symptoms primarily occur during rest or inactivity, typically in the evening or night, and are partially or temporarily relieved by movement. Types. 1. Primary or idiopathic RLS. The most common form, with no identifiable cause. Genetic factors are believed to play a role, and symptoms often begin at a younger age and worsen over time. To secondary RLS caused by an underlying condition such as iron deficiency, renal disease, pregnancy, or certain medications. Symptoms may improve with the treatment of the underlying condition. Causes. The exact cause of RLS is unknown, but it is believed to be associated with 1. Genetics. Family history increases the risk, suggesting a genetic predisposition. 2. Dopamine dysfunction. Dopaminergic pathways in the brain, which are involved in muscle control may be disrupted. 3. Iron deficiency. Low iron levels, particularly in the brain, are associated with RLS. As iron is vital for dopamine synthesis. Risk factors. 1. Family history. Genetic predisposition increases the risk. 2. Gender. Women are more likely than men to develop RLS. 3. Age. RLS is more common in middle-aged and older adults. 4. Pregnancy. Symptoms can worsen during pregnancy, particularly in the third trimester. 5. Chronic health conditions. Conditions like renal failure, peripheral neuropathy, and iron deficiency anemia increase the risk. Complications. 1. Sleep disturbances. Frequent movement and discomfort can lead to insomnia, resulting in sleep deprivation. 2. Daytime fatigue. Poor sleep can cause excessive daytime sleepiness and fatigue, impacting daily activities. 3. Mental health issues. Sleep disturbances and the chronic nature of RLS can lead to depression, anxiety, and decreased quality of life. Pathophysiology. The exact mechanism is unknown, but several hypotheses exist. Dopamine dysfunction in the central nervous system is thought to play a key role, as dopamine helps regulate movement and sensory processing. Additionally, iron is crucial for dopamine synthesis, and low brain iron levels might impair dopamine function, exacerbating RLS symptoms. The pathophysiology of restless legs syndrome involves complex interactions within the central nervous system, particularly affecting dopaminergic pathways and iron metabolism. Here is a step-by-step outline of the process based on current understanding. One, genetic predisposition and environmental triggers. 2. Dopamine dysfunction in the brain. 3. Iron deficiency in the brain. 4. Increased dopaminergic receptor sensitivity. 5. Circadian variation in dopamine levels. 6. Role of other neurotransmitters. 7. Peripheral sensory involvement. The uncomfortable sensations in the legs may partly result from abnormal sensory nerve activity, though this is less understood compared to central nervous system mechanisms. In summary, the pathophysiology of RLS involves a combination of genetic predisposition, dopaminergic dysfunction due to decreased dopamine activity, or receptor hypersensitivity, iron deficiency affecting dopamine synthesis. Circadian influences on dopamine levels and possible peripheral sensory involvement. This intricate interplay results in the hallmark symptoms of RLS, including an uncontrollable urge to move the legs, particularly at night or during rest. Signs and symptoms. 1. Unpleasant sensations described as tingling, burning, or itching sensations in the legs. 2. Urge to move. Uncontrollable need to move the legs to relieve discomfort. 3. Symptoms onset during rest. Symptoms are typically worse at night and during periods of inactivity. 4. Temporary relief with movement. Moving the legs often provides temporary relief. 5. Periodic lymph movements. Involuntary jerking or twitching of the legs during sleep. Diagnosis. Diagnosis is primarily based on clinical criteria, as there is no specific test for RLS. Key criteria include: 1. Urge to move the legs. 2. Worsening of symptoms at night or during rest. 3. Partial relief with movement. 4. Additionally, iron studies may be preferred to assess ferritin levels, as iron deficiency is linked to RLS. Sleep studies and neurological exams may also be conducted to rule out other conditions. Nursing diagnosis. 1. Disrupted sleep pattern related to periodic lymph movements and discomfort. 2. Fatigue related to interrupted sleep. 3. Impaired physical mobility due to discomfort in the legs. 4. Anxiety related to chronic discomfort and sleep disturbances. 5. Deficient knowledge regarding management and treatment of RLS. Management, medical management. 1. Iron supplements prescribed if iron deficiency is identified. 2. Dopaminergic agents, medications like pramipexole and ropinirole can help by stimulating dopamine receptors. Three, anticonvulsants. Gabapentin and pregabalin may relieve sensory symptoms. 4. Opioids and benzodiazepines used for severe cases under strict medical supervision. In nursing management, 1. Encourage regular exercise. Moderate exercise can help reduce symptoms. 2. Educate on sleep hygiene. Promote consistent sleep routines and relaxation techniques. 3. Encourage avoidance of triggers, caffeine, alcohol and nicotine may worsen symptoms. 4. Administer prescribed medications. Follow up with patients on medication adherence and side effects. 5. Iron-rich diets. Suggest iron-rich foods like leafy greens, legumes and lean meats if iron levels are low. Treatment on lifestyle modifications, reducing caffeine, alcohol and tobacco, establishing good sleep hygiene. 2. Pharmacological interventions, medications as maintained above. 3. Non-pharmacological approaches, massage, heat cold therapy and relaxation techniques like meditation. Psychosocial medicine, RLS can have significant impact on mental health due to chronic discomfort and sleep disruption. Psychological support, counseling and education about managing symptoms are essential to improving patients' coping mechanisms and reduce anxiety or depressive symptoms. Prevention. 1. Regular exercise. Engage in moderate regular physical activity. 3. Avoiding triggers, reducing intake of caffeine and alcohol. 4. Routine checkups, regular monitoring of iron levels in at-risk individuals. 5. Sleep hygiene, maintaining a consistent sleep routine. In conclusion, restless leg syndrome is a chronic, often debilitating disorder that significantly affects quality of life. Understanding its pathophysiology, identifying risk factors, and implementing both pharmacologic and non-pharmacologic treatments can aid in symptom management and improve patient outcomes. Thank you. Have a nice day.